you, Dr. Poon. We're actually ahead of time, so we're going to go straight into our first keynote. It is an absolute honor and a joy to introduce our first keynote speaker, someone who has been not only a mentor to me and many of us, but also a close collaborator and friend over many years. Professor Jim Sallis is a name that resonates across our field, not just for the sheer volume of his contributions, but for the depth, impact, and influence of his work. He's a Distinguished Professor Emeritus in the Herbert Wertheim School of Public Health at the University of California, San Diego, and a Professorial Fellow at the Australian Catholic University in Melbourne. His pioneering research has fundamentally shaped how we understand the role of policy and the environment in shaping physical activity, nutrition, and obesity outcomes. With more than 800 scientific publications to his name, he remains one of the most cited scholars across any discipline, a testament to both his scientific brilliance and his commitment to creating healthier, more equitable, and more sustainable communities. But beyond the impressive CV, what I've always admired most is Jim's ability to think across boundaries, to mentor generously. We're so grateful for his time he put in all of us, and to relentlessly pursue research that matters, research that doesn't just sit in journals, but moves into the real world. Please join me in welcoming a true leader in our field and someone I'm incredibly proud to call a colleague, a mentor, and a friend, Professor Jim Sallis. Of course, you know, as a tradition here at ISBNPA, when we applaud, we stand up. So we haven't done that. So let's do that. That's it.
Okay, tell me what I need to do here. So this is the big green button. Okay. Okay. All right, thank you. Kia ora, everybody. We are here at ISBNPA in Auckland, finally, as has been said. Erica was kind enough to ask me to be a keynote in 2020 and to ask me again for 2025. So by that measure, I've had 5 years to work on this talk. And I will make a confession that I have not spent all my time working on this talk. But I do consider this an honor and a responsibility to use this time, our time, wisely. And I really fully embrace the theme of this meeting about people, the environment, and the future. So I have tried to put together a talk that is true to that. And so let's see how I do. Okay. So you can read the title, so I won't do that. I'm going to have a preview. I can read better from here, so I'm going to do that. I think we should celebrate being in Auckland. And I just want to, oh, thank you for making that bigger. Oh, now that's much better. Okay. And so this is a photograph I think I took of the spectacular Rangitoto Island. If you get a chance, and I encourage you to do so, to take a ferry there and hike there and see the beautiful New Zealand nature, spectacular. And there's also wonderful built environments there. The bottom is a picture that I took in the little suburb where I took the ferry over there. Okay, so, but we are applied scientists in ISBNPA, which means we have goals beyond just publishing articles and advancing science. Our science is for a purpose. It's to improve the world. And so I've been really driven in my career by the desire to have an impact, a positive impact on the world. And of course, that's a goal you can never fully achieve. But it's a goal that that emphasizes the meaning of the work that we do. And so my goal in this talk is to expand the societal benefits of our collective work. And so I'm going to try to provide some ideas, some tools that hopefully some of you will find useful, hopefully interesting to most of you. So let's get going. This is going to be a little bit of a journey. I'll go pretty quick as I can in some of this. So, but I like to give a preview. So I'm going to use a theme to introduce this of zoom out, zoom in, and I will tell you what I mean by that. I'm then going to talk about some of the lessons and a kind of overview of the research that I've been doing the latter part of my career on environment and policy to build evidence there to hopefully lead to improvements in environment and policy. And I want to, I'm not going to summarize the field for you. I'm not going to do that. But I'm going to give you some evidence or some examples of how the past 25 years that our field collectively has been focusing more on environment and policy, that we have already had impacts. And so that is to give us some encouragement that this is possible to have impacts. But let's build on that. Let's do more. Let's do better. And a key part of that is to take on the difficult task of communicating our research to people who can use it. Let's not keep our research a secret from the rest of the world by only putting it in journals. And on the theme of the environment, I'm really going to give you some examples of how we have the power as researchers in behavioral nutrition and physical activity to contribute to reducing the negative impacts of climate change and doing some adaptation to climate change. I want to highlight the critical role of the commercial determinants of health that I think we need to be much better at studying and hopefully affecting in a positive way. Because the impact of industry on our whole world is huge, complex, and really maybe it's going to be very difficult for us to change it, but we need to work on that. And I'm going to finish with giving you my experience and my interpretation of what I don't call indigenous knowledge, I call indigenous wisdom. And a kind of a plea for us to think about how to harness this wisdom to improve our work and to improve our world. So that's my, those are my modest goals for this talk. So let's get going. So what do I mean by zoom out, zoom in? You can also think of another metaphor as looking at the forest or looking at the trees. So zooming out, what is the big picture? So for my nutrition colleagues, let's use this metaphor. If you want to grow vegetables, you need first a plan for your garden. Where's it going to go? How are you going to water it? What do you want to put in it? So here's a plan, a starting point, kind of creating a context. For us as researchers, It's what are our priorities? What do we want to accomplish from our research programs in the big picture, not just getting publications, getting promoted, but as applied researchers, what do we want the impact for it to be on the world? And so in your area of interest, what are the most important research questions? We all, every research project is a piece. It's never the whole. But what piece do we want to contribute? So what are the promising solutions that we want to evaluate? What are opportunities for advancing the fields? And what are major barriers that we want to document and then figure out ways around? So that's the big picture. And I think we always have to start out with the big picture. What's important? And before we get to the details, and that's the zooming in. And once we figure what is the most important research that we can do, then we need to get the details right so that our research is rigorous and credible, and feasible. We have to keep that in mind as well. So this is where you use all the knowledge and skills you gained in graduate school and beyond. And this is strong methods. All right, so this is very important. If we want research that's going to be able to improve the world, it needs to be good research. It needs to be quality. It needs to be credible. So this is similar to choosing the right plant varieties for your garden and for your climate, ensuring proper soil, water, sunlight, and care during growth. You need to get the details right. You can't just plan a good garden and then implement it poorly. Then your plants will die. So the details are right, the methodology is important, but that's not what I'm going to talk about. This is about zooming out and getting the right direction, or a promising direction. And I think one of the really important concepts for zooming out is this idea of syndemics. And as I see it, we live in an age of syndemics, which is multiple interacting pandemics. We have a lot of terrible things going on in the world, although the world is beautiful and people can be fantastic, not always fantastic, but we can be. And eating and activity behaviors are important in themselves, so to understand those behaviors, but they are related to other major problems. And this is really an opportunity for us. So we know we really focus here in ISBNPA on chronic diseases. Some focus on healthcare costs, which are downstream from chronic diseases. A lot of interest in health inequalities. Increasing interest in climate change. And our work can contribute to solutions for all of these. And I'll give you one of my favorite sayings that I certainly didn't come up with. I don't know the origin of it. But the saying is that the best solutions solve multiple problems. And healthy eating and active living solve multiple problems. And we need to take advantage of that. And so I encourage you to look beyond one outcome, because there are multiple outcomes that when we intervene and improve eating and activity, we are generating multiple benefits for people and the planet, but we don't necessarily measure all of those. And maybe we can't measure all of those, but I encourage you to measure some of those, because if we only are focusing on one or a couple of outcomes, we devalue the benefits that our research provides to society. And since it's so hard to change these behaviors and to change the drivers of the behaviors, we need to express all the benefits and take advantage of all the benefits that we can do. Okay, so more on syndemics. This is a special issue or a series in The Lancet that I was part of in 2016. And it's about transportation, urban design, and health. And so we focused on these in large part because most of us, and I want to give credit to Billy Giles Corti, who led this effort to put this together. Most of us came from the physical activity field and people who had been studying environment and policy as a way of improving physical activity. But we also wanted to recognize that if we improve land use and transportation urban design, it also has benefits for road traffic injuries, air pollution, chronic noise, social isolation, depression, safety and fear of crime, and infectious diseases, right? If you improve the structure of cities, there's evidence that it improves all of these things, all right? So we need to think about the big picture again, zoom out. So we talked about this syndemic. And so I'm going to come back to that. That started a process. We documented all, the relationship between urban design and transportation to all of these outcomes. So I'm going to come back to that a little bit later. The field of environment and policy in physical activity really is a 21st century field of study, mainly, almost exclusively. And so I want to give you not all the results of those studies where we determined that the way you build a city can affect active transportation, and you see that on the left, and active recreation, and you see a little bit of that on the right. But I do want to show that this relatively young field of 25 years is having impacts on the real world beyond academia. And there's certainly a case to be made and evidence to show that healthy eating research is doing the same thing, but since I'm not really an expert in that, I am going to focus on the physical activity side. So this is an opportunity for others to highlight the healthy eating impact. So here's one. I like to tell the story when colleagues and I, Brian Salins and Larry Frank, published the first paper in the health literature about walkability of neighborhoods, of communities. The journal that we sent it to said, the reviewers said, well, this is an interesting paper. We reviewed evidence from the city planning and transportation fields. And they said, this is interesting work, but we don't know what you're talking about. What do these words mean? You need to give us a glossary because we've never heard of these things. So that was a very early 2000s. Less than 25 years later, this U.S. Surgeon General put out not a report, but a call to action to promote walking and walkable communities. So that means that walkable communities became mainstream in the public health field. So that was good. I count that as an impact, all right, from what is this to, hey, this is important and we need to do something about it. One of the reasons for that Surgeon General's call to action was a literature review done by the Community Preventive Services Task Force. And this is a program of the Centers for Disease Control, though it uses independent experts to make judgments based on systematic reviews. And the systematic review determined basically the headline here, that built environment approaches that combine transportation system interventions like having sidewalks and bikeways and places you can safely cross the street, plus land use and environmental design like zoning that puts where people live within walking distance to places they want to go, The combination of these are an effective intervention for physical activity based on a rigorous review of the literature. And so this then becomes a recommendation for health departments across the country in the US to pursue these kinds of interventions. So it puts it on their to-do list. I think that's an impact. The World Health Organization has a global action plan for physical activity, and there are 4 objectives. One of them is to create better social norms for physical activity. One of them is create active environments, all right? And they can make that recommendation because of the research that's been done in the past 25 years. Then create active people. Well, this is the kind of thing that I was trained to do as a psychologist. Educate, motivate people, teach them skills about how to change their behavior, all right? So yes, that's important as well. And then create active systems. That's the policies. Let's have policies that are consistent with promoting activity instead of policies that are consistent with reducing activity. And by that I mean, let's say in the US, our Federal Transportation Department spends 98 to 99% of their money on supporting driving and 1% or so on promoting walking and bicycling. Those are policies that reduce physical activity. WHO policy and guidelines, I think that's an impact. Here's an interesting one. The Urban Land Institute is an organization of real estate professionals and funders of real estate. And they adopted an initiative they called the Building Healthy Places Initiative. And they said, we want to build places that improve the health of the people. And they didn't do that before the research came out, and they noticed the research, and a member of our team in San Diego was an advisor on establishing the principles and goals of that work. Here's another global impact, walk score. So this is, again, walkability now is not just known. This walk score will tell you, it's an app that tells you the walkability of a city, a neighborhood, or even an address. And this website or this app is on basically the website of every real estate office in the United States and many around the world. I don't know how many countries this is in, but it's in New Zealand. So I just looked up downtown Auckland, and congratulations, you've got a score of 100 out of 100. So that they called that a walker's paradise. And you walk down Queen Street, and you can, if you live within walking distance of, let's say, places like Queen Street, you can get everything you need. You know, food, entertainment, activity, all kinds of stuff. I picked a suburb randomly, Howick. I don't know anything about it, but I saw that on the map. I'll look at that. And so their score is 68. Their walk score is 68, which is not bad. What they call it, somewhat walkable. And they also give a transit score of 41, which is not too good. So you can look up your address. Just go to walkscore.com, look up your address, your town, whatever. This is ubiquitous now. And they specifically used research that our team has done in San Diego, or our San Diego-based team, as part of the development of this now ubiquitous service. So that's an impact. Similar, the AARP. If you're not in the US, you probably don't know this. This is a membership organization that mainly serves the needs of older adults. It's the biggest membership organization in the US with over 40 million members. Based on the research Specifically, they developed a program in livable communities and age-friendly communities. And walkability is the core of that. And so they now, on their website, they have a program that's similar to WalkScore, but is much broader and deals with, many more aspects. Can seniors get access to services, healthcare, that sort of thing? So again, a huge organization has taken this on and says, oh, we need this for our members. And so I wanted to show these things because I think these are meaningful examples. That doesn't mean that we're done and the world is more walkable now, it's activity friendly, far from it. But we've made an impact, we're making progress. But these impacts did not happen automatically. So I love this, this overly optimistic illustration. This was a response to a paper we published some years ago with international results showing that sidewalks were very important for people's activity. Not brain science, but an important finding to make the case. But it's not the reality that after that study is maybe publicized, the trucks come out the next morning and start pouring sidewalks. Doesn't happen that way. There are lots of steps in between publishing a finding and action based on that finding. So there's already been a big workshop on research translation at this meeting. Very happy. Wish everybody was able to attend that. And in our Lancet series on urban design and transportation, we said, the evidence about urban design and health is accumulating, and the biggest challenge is translating it into policy. And so we came up with 4 kind of principles of what needed to happen. First, we need to conduct policy-relevant research so that the findings have some recognizable relationship to policies that are in place or could be in place. And second, we want to use research methods that are relevant to policymakers. And this is more difficult than you might expect, because some qualitative research with policymakers asks, well, what kinds of information and research is most convincing to you, would be most useful? And most of them said, well, case studies. Well, for researchers, case studies is the bottom of the barrel for methodology. All right, so that's a challenge for us. And I think, the way that we deal with that is we do the rigorous research and have solid science, but then we find stories and case studies to illustrate those findings in a more accessible and compelling way. And then here's one of the biggest challenges, and this is a message to us, to actively disseminate findings. All right, so that is something we need to do, and that we need to engage in advocacy. So I hope that we all learn and are open to getting more involved in advocacy and communicating to policymakers. Okay, so the next step is, okay, we've got, I want to give you an example of actions that are being taken to translate urban design and transportation research into policy changes. And so this is a follow-up to our earlier Lancet series, and we proposed that there should be indicators of healthy policies. And in a follow-up in 2022, we published another series in the Lancet Global Health on the same topic. And we reported on a pilot study that we did of taking the indicators that we proposed earlier and implementing those indicators in 25 cities around the world. and we recruited colleagues and others who lived in those cities to collect the data and then hopefully compile the results and feed it back to decision makers within their city. So I'm just going to go through this very, very quickly. So we call this the Global Healthy and Sustainable Cities Collaboration, Indicators Collaboration. And again, Billy Giles Cortide led this effort, and you'll see some other people that you might recognize here. Esther Sarin is a key part of this. And the current co-leaders are Melanie Lowe in Melbourne and Erica Hinkson here. So it's very diverse, it's international, it's interdisciplinary, and we have a great group. And so we did 25 cities, and our goal was to facilitate the development of a global surveillance system of city planning policy and spatial indicators. So we really demonstrated with these 25 cities that this can be done. These indicators can be done, they can be communicated, and we didn't follow up to say, well, what's the outcome? We haven't done that yet, but we hope to be able to do that. And we're focusing on indicators because of saying what gets measured gets done, and not always, but if it's not measured, it's easy to ignore. All right, so we want to measure these things so that we can hold cities accountable for improving them. And so there's two aspects to this. One is policy indicators. And there's a wide range of policy indicators that are relevant to, my main interest in physical activity, but all of those other outcomes of city planning as well. And we're making increasing focus on environmental sustainability as well. And we also want to expand this more to food systems and healthy eating. So that's in process, and we welcome collaborators to help us do that. What we did is we developed a quantitative policy coding system so that we could score the policy, whether how many of the policies that we're recommending as evidence-based do they have a policy for, and what's the quality of that policy. And you can see that there's a wide range, and Auckland is one of the cities, and it's kind of in the middle of the whole range. And so the main point is not to compare, although we think that's useful. The main point is for this to be data, baseline data that cities can use to make improvements in health and sustainability. We also create spatial indicators. And so here's walkability mapped. And this is using open source data and tools that are available not everywhere, but many, many, many places around the world. So you don't have to collect your GIS data from scratch. And here's a couple of examples. And you can see in Sao Paulo, walkability, the pink, is pretty much spread around the city. Whereas in Bangkok, Thailand, the walkability is concentrated in the center, which I think is very common. So we think this is useful, and you can tell from the maps, if you are familiar with the city, it kind of shows you the inequalities across the city as well, which is something you can work on. And we have tools that take the indicator data and automatically generate a scorecard. So here's an infographic that gives some of the highlights in the local language. All right, so that's now automated. So we think better indicators can lead to better cities. Many people, and we found many people, lack access to urban design and transport features that evidence says are necessary for healthy and sustainable cities. So this open data and open source software, I think we hope facilitates and makes it easy for cities, for people in cities to collect their own data and then use it. And so we want this to generate discussions within cities and across cities. And so now we say, all right, that's the result of our 25-city pilot study, and so we think this is ready for prime time. Although we want to continually improve these indicators and expand them, we also want to expand use of what we have now and also later. So we call this our 1,000 Cities Challenge. And there's several people really involved in this that are at the meeting now. If you go to the website, healthysustainableCities.org, you can see who's involved, and I mentioned some of them. Our colleague Eugen Resendez brought some buttons, some pins. And so those of us working on this are going to put the pins on so you can identify, because we're welcoming. We're wanting to bring more people into the family, to take evidence to policy and practice. That's the goal, and you're welcome to be a part of it. All right, so I'm going to the next topic, and that is climate change. In some parts of the world, in my part of the world, this is controversial to say climate change is here and now. But the evidence is here. A lot of people are living through it. It's already a significant health problem around the world, or set of health problems. And so as experts in behavioral nutrition and physical activity, we can contribute to healthful solutions in climate change. As you see from this graphic of the sources of global greenhouse gas emissions, agriculture and food systems is one of the highest, as is transportation. And transportation is either active or inactive, but it's on the activity spectrum, and so something that we need to be paying attention to. And I would say, I would like us to see this individually as our responsibility to help solve multiple problems of health and climate change. So I'm gonna just give you a couple of tidbits here about how research and advocacy on active transportation is central to personal and planetary health. And this is kind of an obvious finding from one of our studies of adults in the U.S. We recruited people from low walkable and high walkable neighborhoods, and also low socioeconomic status and high socioeconomic status neighborhoods. And this outcome here is just self-reported minutes of driving or riding in a vehicle, in a private vehicle, during a week. And you can see that the pink bar, people who live in low walkable neighborhoods, do a lot more driving than people who live in high walkable neighborhoods. The reason is well known, because low walkable neighborhoods mean you have to drive everywhere. And so people drive everywhere, and that translates into a lot more driving. That's, on average, you see here, about 100 minutes per week. All right, that's a lot of greenhouse gases that people in low walkable neighborhoods don't have to generate. And so land use and transportation, very important here. And just to, I took out the slide showing that people in high walkable neighborhoods walk for transportation a lot more. So their physical activity is assisted by where they live. All right, so walkable neighborhoods, more activity, better health, and less driving, less greenhouse gas emissions. That's solving multiple problems through zoning, a city policy. So this is but still in the United States, certainly at the federal level, the policy is to spend 98% of federal transportation money on cars and vehicles. So we have a lot more research translation to do and a very difficult political environment to try to do it. But we need to take this on. So another solution that I like to talk about is that we need to take on is to get more involved in climate action and climate discussions and climate research to represent a health point of view. So I give the example here. Transitioning to electric cars and micro-mobility devices is a lot of people in the climate world see, this is our solution in the transportation area. We just need more electric transportation with e-scooters and e-bikes and e-vehicles. But I want to next show you evidence that that may not help health very much at all. So we need to conduct studies on these technological innovations to assess which solutions, which climate solutions also generate health benefits. And so let me give you this example. Pardon me. So this is one of a few studies, and this is not hard data. I would say this is modeling study, but based on a lot of other evidence that came out a few years ago. And their goal was to evaluate two scenarios, two transportation scenarios, to assess the effect or the expected effect on health and on climate. And so the two scenarios are replace all passenger cars with EVs, all electric vehicles. And the second scenario is replace 25% of car trips with walking or bicycling. All right? So active transportation. And so and what they do here is they estimate the impact on mortality related to the three mechanisms by which cars kill people. Let's just be clear about that. And so one mechanism is road crashes. All right? So if you replace all cars with EVs, you have no impact on road crashes because you have the same drivers driving the same way. Doesn't change the driving. But in fact, in the active travel scenario, you actually increase deaths because you get more people walking in environments that are dangerous for walking. All right? So that means we need to do other things as well. So let's look at another pathway. And that is called PM2.5, so particulate matter, so it's air pollution. Cars, burning fuel, generate air pollution. So, in this one, the EV solution reduces deaths by 1,400. So that's some benefit there because you're reducing air pollution. The active travel scenario doesn't reduce fossil fuel burning as much, so you get a smaller benefit. And in the transportation field, they're well aware of the risk of road crashes and air pollution. They are working on that. They have models. This is part of their work. But what you can see here, and this is validated by other studies, that the most deadly pathway of cars is the sitting while you're driving the car. And you can see here, if you move everything to EVs, you reduce deaths on the physical activity pathway by 0, because you're still sitting the same amount. But if you get people walking and bicycling, you get all the benefits of physical activity, which we know are tremendous. There's no question about that. And so the benefit of the active travel is you save 52,000 lives in this modeling. Okay? And you can see that that is by far the biggest number in this table. And so if we only focused on EVs and without promoting and facilitating active travel and safe active travel, we would be making a terrible mistake. And so the transportation people are not talking about that. It is going to be up to us, health professionals, to introduce this and to promote this as a major point of discussion and a goal. So that we need to look for the double win of climate and health. And so if we go to the carbon emissions there on the end, if you reduce car travel by 25%, you get some carbon emission reductions. And so that could be estimated. You can't really estimate it for the EVs because the amount of carbon emission reduction for EVs depends on where you get your electricity. Are you burning coal, natural gas, solar, wind? Well, that's an unknown for most places. You could model it if you know the source, all right? But it's not guaranteed. So to me, this is a really important policy discussion that's going on worldwide and is a good example of what we as health professionals and physical activity professionals need to bring to this discussion. We need to insert ourselves into this discussion because we are not being invited. Our local program chair, Erica Hinkson, last year took it on herself to insert herself into climate change discussions at the COP meeting, you know, the climate discussions. And she said there was almost no other health professionals. There were not few, if any, health organizations that had booths or programs. Our agenda is being left out, meaning the physical activity and nutrition benefits of more thoughtful win-win solutions to climate change are not being considered. I think that is our responsibility to speak up and find ways of doing that. And it's, like I said, it's not easy. But I think this is worthwhile and how we increase the impact of our research. They need to know what we know. Okay. I want to talk about one other solution. This one seems like it could be simpler. As the climate gets hotter, people are going to be more discouraged from going out and being active. And yes, you can be active indoors. If you go to a health club or you have a treadmill at home. But you can't do active transportation indoors. You can't walk to somewhere indoors generally. I guess in Minneapolis in the US, they have a whole network of underground passageways that people can use when it's, minus 40. And minus 40 is the same, Fahrenheit and centigrade. But I don't know that we want to become mole rats or something. I don't think that's a great solution. We may come to that, but I hope not. So it seems to me like a better solution is to adapt to hotter temperatures as we try to mitigate climate change and reduce the increase in temperatures. And so shade is one way of doing that. And here's two strategies for providing shade. One is trees. That's I would say, time-tested solution for cooling a place. And also making a place more beautiful and more comfortable and more desirable for walking or biking or being outside. So there's that. The other is architectural design. And here is a building, and I took this picture in Saudi Arabia. I was there a couple of years ago, and I said, oh, good, I'm going to the Middle East where it's always been hot. So they must have a lot of great ideas for shading places and making them more comfortable. And if they had great ideas there, I didn't see them. What I saw in the centers of cities were tall buildings or buildings of medium height with the building here and the sidewalk there and no shade whatsoever. No trees, no awning, no design. I have to say I was disappointed. But I did see this. And I said, that's a good solution, because at least the people walking along that pathway are shaded. Okay, so good. So I think, let me just say, there's a lot of room for creativity, study, and international collaboration to try to find and evaluate solutions for making sure our cities don't become so hot that people can't or don't want to or will not get outside and do active transportation. And we have alternatives to active transportation now. Delivery services you may have heard of. I don't think that's a great solution, so that people can just cocoon in their house, never go out. Yes, they can get food and they won't starve, but that's not a healthy way to live. So let's turn our creativity, our brilliance, our energy, our scientific rigor to questions like these. And I prepared this slide. Let me just tell you, I prepared this slide for an online workshop that was done a couple of years ago by the National Heart, Blood, and Lung Institute of the U.S. National Institutes of Health as part of their climate change and health research initiative. They were looking for outside input into research priorities. And I was honored and pleased to do that, and excited about this kind of initiative coming out of NIH. Well, it won't surprise you to know that obviously that whole initiative was terminated very early in the recent administration, and among many other things. So I am presenting it to you now as an alternative recipient of these kinds of ideas. So please do something with it. Do what you can. Okay. So another thing about trees. Trees are helpful for adaptation and mitigation. All right. So cooling as the planet is hotter, cooling places so that hopefully they're more reasonable for activity. And also trees sequester carbon. All right, they don't do it very quickly, so we need to act quickly so that they have time to grow and take some of the carbon out of the air. They also take other pollutants out of the air. So again, solving multiple problems. Okay, here's something that I just think is so important and that not enough people know about. How many of you are familiar with the concepts of the commercial determinants of health? Is that common? Okay. All right, many of you, but not most of you. All right. That's why I wanted to talk about this. This is what I show here is the cover of a Lancet series on commercial determinants of health from a couple of years ago, 2023. I just want to give you the briefest of summaries of this from one of the introductory articles, and these are quotes. The climate emergency, the non-communicable disease epidemic, and the fact that just 4 industry sectors, tobacco, ultra-processed foods, fossil fuel, and alcohol, already account for at least a third of global deaths, illustrate the scale and huge economic cost of the problem of industries promoting unhealthy behavior. All right? This is not a new problem, but this is an enormous problem. And this is not a substitute to work on the social determinants of health, but it is a complement to the social determinants of health. And of course, as going back to our syndemic concept, they are interrelated. Okay, so then increasingly powerful transnational corporations have created a pathological system in which commercial actors are increasingly enabled to cause harm and externalize the cost of doing so. So what does it mean to externalize the cost of creating harm? All right, so it's, let's take fossil fuels. We know that burning fossil fuels is creating health problems, it's creating environmental problems, that's costing the world huge amounts of money. But the fossil fuel companies do not pay those costs. That's what it means to externalize the cost. They profit from creating those problems, but they don't take any responsibility for solving those problems. So externalizing your cost is a brilliant way of doing business, but it is a morally horrible thing to do. But it is the way business operates. Okay. And although many policy solutions are available for dealing with commercial determinants, they are not being implemented. Okay, let me just, and I would say that this idea has been around a while. It's not a new idea, different terms. And so on the left is a introduction to a special issue of the American Journal of Preventive Medicine, I think that's 2004, that we called Economic Analysis of Eating and Physical Activity. It also includes a kind of primers on economics as they relate to eating and physical activity. So I was involved in that, but I modestly encourage you to look it up. The other is this book called The Bottom Line of Public Health, and it has a chapter on each of the industries that we should be paying attention to. This is from 2010. I think there might be an update on this, so I really congratulate Professor Wist on this book. Now I have late-breaking news for you about another aspect of, or another opportunity to get involved in the commercial determinants of health. This year at the Society of Behavioral Medicine in the US, we had a gripping presentation by Steve Downs on the research that he's been doing and conceptualization of the product environment. And so what are products? Well, food, buildings, anything you can buy in a store. Some of those products are going to help your health, and most of them are going to hurt your health. So he wants to put a spotlight on how can we promote the design of healthy products. And so this is a relatively new effort, and he's inviting people to get involved. Oddly, you might think he calls the name of this project is Building H, because in some way his headquarters is in Building H. I encourage you to look that up on the internet, and you can talk to me or Professor Abby King, and we've been starting discussions with Steve about developing a research agenda. All right, and if you want to be involved in that or informed about it, go to the website or talk to Abby or myself. Building H. Okay, So I would ask you to consider the commercial determinants of health when designing your research. Tobacco control people have been working on this for a long time, opposing and weakening tobacco companies. They have led to increased taxes. They have led to greater regulation. They have led to altering public opinion, and they have led to lawsuits that take money away from tobacco companies. I think that's one of our great public health success stories of the past century, I would say. The healthy eating field has targeted various components of the food industry. Healthy eating folks, you're doing a great job of that and had focused on this for a long time with sugar-sweetened beverage taxes. We're trying to reduce marketing to children, nutrient labeling, working on ultra-processed foods. But we can ask what other food industry activities could be targeted to expand this important work. In the active living field, we've targeted a few commercial activities, but government policies has been more of our focus. Active transportation investments, more and better parks, school physical education. But there are many industry actions to study. Micromobility regulations, for example. Let's say, still we need a lot of regulation, changing government transportation goals, regulating youth social media, fossil fuel disinformation. So lots of opportunities here. This is a wide open area. I encourage you to get involved. We need to make impact on this huge focus, huge set of problems coming from industry. Okay, I want to end with talking about indigenous wisdom. And I have a lot of caveats here. I am not an expert. I am going to talk to you about my own experience, my own interpretation, and if I encourage my indigenous friends to tell me what I've got wrong. But I wanted to highlight this here. And I think I've come to believe that indigenous wisdom holds much promise for solving problems. And here's my story. 2 years ago, Erica Hinkson organized a working meeting here in Auckland, and it included 3 days of immersion, helped thanks to a competitive grant that she got that supported us to come here, people from all over the world. And this rare connection with the Maori people here, I would say, was meaningful for each and every person who attended, absolutely everybody. We appreciated the generous sharing and patient explanation, particularly of their worldviews and values. And a special thanks to Rob Hogg, who you now all know, to Dr. Isaac Warbrick, who will, I would assume, be here later, and Dr. Scott Duncan, whom you've already heard of. And one of the culminations of this was being able to go out on the water after learning about the significance of canoes in Maori culture and a little bit about how to operate them. And so we got to go out and test our skills a little bit. But more importantly to me, I want to pass on my interpretation of what they described as the Maori worldview. And they made it concrete with this triangular symbol, so the sides on the top are land and water, with people on the bottom, and their explicit quote to interpret that is, "Place is more important than people." And I have to say that just stopped me right there. I'd never heard that put that succinctly and that clearly. So, and this a few seconds later, it occurred to me an obvious interpretation is that the Western worldview is the exact opposite of that. People are more important than water and land. And which is why we destroy ecosystems at will, constantly, in huge numbers. And it also occurred to me that over time, we have added another element. And unfortunately, we have put that on top. And you won't have to think long to figure, okay, that's money, right? And that's all what the commercial determinants of health about, is industries are willing to sacrifice the health and lives of people in order to make money. It's that explicit. And of course, not even considering the impact on land and water. Okay, my reflections, and then I'm really pretty much done. Indigenous people worldwide, in my experience, have generally lived in harmony with land, water, and air for thousands of years. A few centuries of Western-led colonization, followed by the Industrial Revolution, starting with burning coal for everything, has disrupted and destroyed ecosystems, polluted the entire planet, and brought on climate change with its growing health impacts and biodiversity loss. These seem like big topics. And this is really about the future, which is, one of the themes of this meeting. And so we are not on track to limit the consequences of climate change. Each year, total emissions increase, still now. So how can we use indigenous knowledge to solve our most pressing problems? And this is a question. This is not a pretend question. This is a real question. My own kind of thought about this is, if we don't adopt more of an indigenous worldview where we prioritize the protection of the land and water and the planet, we're just going to be in for a world of trouble. Climate change will eventuate in the predicted outcomes that science tells us are coming, and coming quickly. So really, this is a real question I would like you to ask yourself and contemplate for some time. And the other one, how can research be used to translate some of this indigenous wisdom into action? I think this is because this is a new revelation for me, and you might say, what took you so long, or how could you have been so stupid? But I don't know. Somebody convinced me I'm wrong, that a solution to our climate problems may require an indigenous worldview, this Maori value that place is more important than people, and certainly more important than money. So I'm going to leave you with that, because I don't have answers. Okay, a recap. Keep doing rigorous studies on important topics, your zoom in work, but zoom out to consider how your research can be more impactful in this age of syndemics. We identify and assess additional outcomes for your research, including those related to planetary health. Even if you can't measure other outcomes perfectly, include them in some way. Whoops. Oh, now. Okay, I can go back, I think. Okay. Become active in research translation by communicating useful findings to those who can use them. I used to tell my students, if you come up with an effective behavior change intervention, you need to be responsible for getting that research into policy and practice, because nobody is going to do it for you. Nobody is a better better expert or more motivated to promote your intervention than you. So I think this is something that applies to us all. And be prepared to study commercial determinants of health. I think there's huge opportunities. I won't say it might be easy getting funded to do this work, but we need to be smarter, and then learn how to use indigenous wisdom and how to apply it. So, ISBNPA members, please expand our impact beyond individual health to include planetary health, And I hope at least some of these tools and ideas are useful to you and help you accomplish bigger goals. So there's a QR code to my website, and that's it from me. And I think we might have a little time for a Q&A, and there's going to be another panel. So I will say thank you as a cue for you to provide active applause for yourself. Okay.
No, don't go too far. Jim. Thank you so much. Okay. No, just stay here. No, just stay here. Yeah. Right, thank you so much for that talk. Very thoughtful, thought-provoking, and lots of pearls were shared, so thank you very much. I was planning to do a little summary, but I know we've had people here for a long time, so we're just gonna go straight to Q&A. So if you have any questions for Jim, please let us know. And we have these catch boxes here. It's a microphone that you could speak into the microphone. So just basically wave like that if you have a question, and we will throw the cube over to you. I see Pedro may have a question. He's coming down. No. Any questions for Jim? Any questions? Yeah, thank you.
This is so cool. Jim, I think, back to the amazing talk as usual. Thank you so much. Back to the commercial determinants of health. Now, who are the enemies of physical activity promotion? Because we can name the enemies from the tobacco industry, the healthy eating. Who are the enemies for physical activity promotion?
Oh, I've been told many times that there are no enemies of physical activity. Everybody thinks it's great. But I was at a meeting with Abby a few years ago on the Stanford campus, and we were talking about sedentary behavior. This is quite a few years ago, I guess, because the news of the day was that the billionth person had just signed up for Facebook. And I learned that one of Facebook's primary metrics of success was billions of eyeball minutes. And those eyeball minutes are basically another measure of sitting. So I consider the biggest industries in the world to be enemies of physical activity. We'll start with fossil fuel companies. They don't want us walking and biking. They want us driving, right? So cars are the most advertised product in the United States. Cars don't want us walking and biking. They want us to use our cars until they wear out and then buy another one. All the tech industries, all the social media, computer games, esports, all of those, they make money only when you are sitting. Any industry that requires you to sit for them to make money, that's an enemy of physical activity because they're promoting sitting. All of their advertising is about sitting. The biggest industries in the world are enemies of physical activity. Okay? Prove me wrong. All right.
One more question, if we can take one more. Yes.
Okay, this is so cool. Yeah. And I told myself, if it's not fun, I'm not doing it. So, so I was wondering what your thoughts were on basically people being disconnected from the land and not having opportunity or access or any of those things to have time to build relationship with the natural world, to sit, to be in that sort of intimacy that a lot of us are deprived of or in lack of. And so I was just kind of wondering what your thoughts were around that.
Yes, thank you. in my experience, in a lot of places, I don't know every place, but certainly in the US, things like parks are seen as, well, that's nice, right? You know, have a park. And a lot of times they say, oh, well, we'll make a park for your neighborhood, and it's an open field of grass, and that's it. Or maybe a small playground somewhere. And there's no effort most of the time to create what I would say is a natural experience. One of one of the people who I think has been a great advocate for the importance of contact with nature wrote the book Last Child in the Woods. And he's from San Diego, and which I was proud about. And he started the Child and Nature Network to educate people about the importance of getting kids out in the world. And you know, I think that has been a trend in physical activity field to appreciate you know, the importance of getting people, you know, in nature, and starting to research or try to document the co-benefits of being in nature. So you're not just being active. You have a stress relieving experience. You have a more peaceful experience to bond with other people. And so I think that is a definite trend. So people are seeing the value in it. I think there's a lot more research to do, but I will just tell you my personal experience. Since I've been retired, one of my two primary priorities is hiking more in nature. And so I have now a more personal, dramatic experience of the value of being in nature and seeing all the diversity and running across things that are surprising, and just appreciating the beauty and the incredible knowledge and wisdom that has resulted in the diversity of life that you can see really only in nature. Because when we build cities, unfortunately, we bulldoze all of that and then put up something completely different. We don't have to do that. We don't have to do that. And I'll give you one other, I think, really encouraging thing that I just read about a few weeks ago. Maybe some of you saw this. The mayor of Paris, France, said that her next initiative is to create a forest network within Paris. And by that, she says, we're going to bulldoze existing streets and we're going to turn them into forest. They're going to make a network of kind of pathways of urban trails with forest. And I am absolutely on the edge of my seat to see what she does with that. But that's the kind of vision. So people are starting to see what we have lost by separating ourselves from nature so much and not valuing nature. And there's so much more to do. But I like to look for rays of hope so that we can try to magnify those. So thank you for that question. Okay.
No, not yet. Thank you, Jim. Who says you're retired? Thank you very much, Jim. And as a small token of our appreciation, we'd like to present you with a Pounamu, a greenstone, which is a town treasure gift here in Aotearoa, New Zealand. So thank you so much for this thought-provoking and inviting talk. Thank you so much. Okay, so